dental, free and expanding a gymnasium in a many months long project. And I will get the cost, although that may be hard to do. So let me get this straight again. And the American people should understand. We just voted to cut drastically a program that seniors have taken advantage of, which gives them additional hearing, vision, dental, and physical fitness care while we practice it here every single day. Every single day there is a physician on duty, or more than one, not very far from where I speak, who is ready to give us instant care. If his hospitalization is needed, instant transportation to the Bethesda Naval Hospital, where we will get free care. And incredibly, the Senate, on largely partisan lines yesterday, voted against senior citizens in this country, most of whom have paid a lot more into the program than we have. We're going to deprive them of what we have every single day we are members of the United States Senate. That, my friends, is an exercise in hypocrisy. And the senator from Pennsylvania has it right. He says, because the president time after time said to the American people, if you like the insurance policy you have today, you can keep it. How many hundreds of times have we seen him say that in town hall meetings, and his administration mouthpieces say the same thing? The fact is, the senator from Pennsylvania, Senator Casey, is right when he says we're not going to be able to say, if you like what you have, you can keep it, said Senator Bob Casey, a Pennsylvania Democrat, and that basic commitment that a lot of us around here have made will be called into question. Now, I'd just like to say a couple of words, and I'll be talking a little bit more about it later, about every time that the senator from Montana is on the floor and others, they talk about the fact that AARP now supports this blatant transfer of funding from the Medicare program, which the seniors have earned, into a brand new $2.5 trillion entitlement program. That's what this bill is all about. So, just for your information, AARP has received $18 million in stimulus money. Now, there's a job creator for you. AARP, which has given its full-throated support to Democratic health care legislation, even though seniors remain largely opposed, received an $18 million grant in the economic stimulus package for a job training program that has not created any jobs, according to the Obama administration's recovery.gov website. Now, that is astonishing to me because everything I've ever seen, they've created millions of jobs, including in the 9th Congressional District of Arizona, where they said they created some thousands of jobs, which unfortunately for me, we only have 8 congressional districts, but that's okay. So in February, the Politico reported that AARP was putting pressure on Republican members of Congress to support the stimulus package. Since then, AARP has moved on to lobbying for passage of health care legislation, even though Democrat proposals have called for several $100 billion in cuts to Medicare, a program that the group typically defends tooth and nail when Republicans propose cutting it. Turns out AARP is also in a position to benefit financially if the health care legislation passes, because seniors losing benefits as a result of cuts to Medicare Advantage will be forced to buy Medigap policies, which is the main source of AARP revenue. Barry Rand, the chief executive of AARP, was a big donor to the Obama campaign and has retained a cozy relationship with the administration. That's shocking news. So, my friends, also I might add that in 2006, the AARP received $18 million from the federal government, and we are researching additional federal monies that they get. But the most important thing is that, let's make it clear, AARP will receive direct benefits because seniors who have their cuts in Medicare Advantage and other Medicare programs can buy guess what? A Medigap insurance policy, in other words, to cover the things that have been cut back under this legislation, and it costs $175 a month. The Medicare Advantage premiums for most seniors are $0 or $35 a month. So if the Medicare Advantage plans go away, people would have to buy Medigap plans sold by, you got it, AARP. And some low-income seniors couldn't afford $175 a month. That's why what the senator from Tennessee stated, if we drive people out of Medicare Advantage, we are harming low-income seniors all over this country. We are harming them. We are doing them a great disservice. And if you think with 17% real unemployment in my state, that seniors who are unemployed and down on their luck are going to be able to afford the AARP Medigap program policy for $175 a month, then come and visit my state. And I'll tell you, they can't. They can't. So it's interesting, the conversation about how high-income seniors and how that we're going to tax people with Cadillac plans and all of those things, when we're really what we're really doing is harming the low-income seniors in rural areas of America. And
would my colleague yield just for a quick point? My colleague was talking earlier, in effect making the point that you can't take $120 billion out of the program without hurting folks. Those on the other side of the aisle have said, well, we can do that. We can cut by $120 billion and it still won't hurt anybody. My colleague asked the senator from Tennessee exactly what some of the benefits were and repeated those. So I went back to get the actual statistical number here of how much it will actually reduce benefits in terms of actuarial value. And according to the Congressional Budget Office, in the year 2019, when this is fully implemented, here's the statistic. The actual actuarial value of the reduction in benefits under Medicare Advantage is 64%. In dollar numbers, it goes from $135 a month down to $49 a month. In other words, the very things my colleague is talking about, the vision care, dental care, all of those things, as well.
Things that we routinely use, that we here in the United States Senate. I would hope that those who voted to harm the seniors in this country and not allow them to have dental, vision, other health care would unilaterally disavow the use of the physician care and vision care and hearing care that's available to all of us 24 hours a day right here in the United States Senate.
Mr. President, just the last point, I'd like to say that I hear my colleague loud and clear, and I hope that the American people do too, because you can't call a $120 billion cut something that doesn't hurt people, and especially when the Congressional Budget Office itself says, yes, that reduces these very benefits from a value of $135 a month down to $49 a month. That is a huge cut in the value of the services that they receive under Medicare Advantage, and that's what we are trying to prevent by this amendment.
Could I just mention one other thing, and I'm not going to spend that much more time on AARP. But the reason why I do is because every time the senator from Montana stands up, he talks about that AARP has endorsed this ripoff of the American people. So let me just quote again from a Bloomberg article entitled, AARP's stealth fees often sting seniors with costlier insurance. And I quote from the Bloomberg article just briefly. Arthur Lapis joined AARP because he thought the nonprofit senior citizen advocacy group would make his retirement years easier. He signed up for an auto insurance policy endorsed by AARP, believing the advertising that said he would save money. He didn't. When Lapis, 71, compared his car insurance rate with a dozen other companies, he found out he was paying twice the average. Why? One reason he learned was because AARP was taking a cut out of his premium before sending the money to Hartford Financial Services Group, the provider of the coverage. AARP uses the royalties and fees to fund about half the expenses that pay for activities such as publishing brochures about healthcare and consumer fraud, as well as paying down the $200 million bond debt that funded the association's marble and brass-studded Washington headquarters. In addition, AARP holds clients' insurance premiums for as long as a month and invests the money, which added $40.4 million to its revenue in 2007. During the past decade, royalties and fees have made up an increasing percentage of AARP's income, rising to 43% of its $1.17 billion in revenue in 2007 from 11% in 1999, according to AARP data. This is a Bloomberg article. This isn't from the Republican Policy Committee. So the point is, who gains? Who gains from this legislation? Who's going to make hundreds of millions of dollars more because they provide the Medigap policies that people will be deprived of when we kill off Medicare Advantage? AARP.
Mr. President, I see that the senator from